We'll call the meeting to order. The board values public input and ideas and sets aside this time on the agenda to hear from the public on subjects of concern or support. We will make every effort for each person wishing to speak to be given an opportunity. All information will be taken under advisement. Generally, no action on your input will be taken during the board meeting. But to ensure proper response at a later date, should it be needed, please notify the moderator via the raise of hand or chat function of your wish to speak and limit your comments to 3 minutes. The board appreciates your input. Okay, first on the agenda is the presentation of the budget, or excuse me, is the approval of the consent agenda. We have approval of the October 19th board meeting minutes. Do I hear a motion?
Can you read them all to us, sir?
Sure, I can.
Oh, boy, now you're here it goes.
Keep me on the meeting short.
Yeah. I'll make a motion to approve the consent agenda.
Second.
Is that for the entire
Yep.
3 items?
Correct.
Okay. Is there any opposition? Not objection, the motion passes. Okay, next.
Can I just make a quick comment? For John Gleason, who prepares those, they're really well done. And a lot of people in the public don't get a chance to read them, but they're very comprehensive, they're available. And it takes a lot of patience to summarize, 2 hours worth of meeting notes. So thanks, John.
You're welcome.
And if the public does want to read them, they are available on the website.
Next on the item on the agenda is preliminary presentation of the preliminary budget. Paul.
And we have an overhead for this presentation. So for those in attendance here today, this will be a repeat of the budget that was presented last month at the board meeting. So there are no changes to any of the assumptions, revenues, expenses, capital items on the budget for next year. I'm going to take a minute to walk you through the assumptions that are basically driving the revenues and expenses for next year. Inpatient admissions, 8.7% increase. That sounds like a lot, but it's only 85 admissions over the course of 12 months, which is an increase in our average daily census of less than 1 per day, 0.7. Outpatient visits, 5% increase. No change in our family birthing center numbers. Emergency department, 5% increase. That's 918 visits over the course of the year. On surgeries, pretty big number, 19.7% increase, but there's been a whole lot of recruitment activity surrounding physicians that are being onboarded. Urology is a big part of that increase in admission in surgeries for next year. Adjusted admissions, 7.4% increase, and clinics, 12.6% increase. On the patient revenue side, we are.
Just stop for just a minute.
Yes.
Just a question, that may not be for you, but I hadn't seen before the line that said newborns, no budget increase or decrease. Obviously, we have 3 OBGYNs and practitioners. Why would we not expect to have an increase in newborns?
Well, I don't think the change in population of the island hasn't changed significantly in that period of time. So the number of births is not really in our control as far as. You know, determining how many people are gonna have children. Now, we may be able to capture some of those that are going off the island. But we have no way of predicting how many we may be able to do with that.
Okay.
Okay.
Great, thank you.
Patient revenue side, 5% price increase effective January 1. And no material changes in the other operating revenues. Operating expenses were like almost an 8% increase in personnel costs, volume related. Expense increases on the personnel cost side. Are causing an increase in FTEs at 23, so we've got an increase of 23 FTEs budgeted for next year. And so just know that those expenses are in the budget. And if the volumes aren't there, obviously, we wouldn't be filling those 23 positions. We are moving from self-insured to fully insured medical benefits for our employees, and this is actually going to save us some money next year. We're seeing a total increase in personnel costs per FTE of 3.4%. We are seeing in that FTEs per average or adjusted occupied bed number an increase in productivity. This 0.3% reduction in cost is brought about by an increase in staff productivity. Physician fees 1.9% and purchase services 9.1% increase, which is large, and would not be that large except for all of the work that's going into Meditech Expanse and the costs that are associated with that. Legal fees, 3% increase. Supplies expense, 10.2% increase, brought about by two things: inflation, one, and volumes for the other component of that 10.2% increase. Repairs and maintenance, 3% increase. Insurance, 10% increase. Utilities, 3.2%. And depreciation expense, a 4.5% increase, which factors in $1.5 million in new capital expenditures and the associated depreciation with that 1.5 million in expenditures. The bond interest expense is budgeted to decline by almost $152,000. So those are the elements of that were considered and used in budgeting revenues and expenses for next year. So, John, if we can move on to the next page.
Question,
Yes.
your budgeting and insurance increase of about 10%. About 3 years ago, 2 to 3 years ago, we had a major expense that cost our insurance company quite a bit of money. At that point, they raised the rates substantially. Have we reviewed their rates to see if we can get any adjustments on that? Because I know we are paying a very large amount of insurance.
We are, and Parker Smith and Fee negotiates those insurance rates and premiums for us. And they went deep in terms of what they could negotiate for us in terms of premiums. So I'm confident that we're getting the best price and the greatest value for the insurance that we bought.
Good, thank you.
Paul, what's the basis for the decrease in the bond interest expense?
Yes, sir. So when we pay off principal, we do that every year. It reduces the total amount that interest is incurred.
Obviously, that's a big,
Yeah, so that's just consistent with the increase or the decrease in expense from our amortization schedule.
thank you.
So how do those assumptions play into the budget for 2024? In this column right here, you see a forecast for 2023. We're forecasting total operating revenue of $129 million for this year, which is inclusive of all patient revenues minus revenue deductions, contractual allowances, bad debt, and the like. And then the other operating revenue, which is largely levy money. So with the 5% price increase and the increased volumes that are budgeted for next year, we see an increase in total operating revenue of a little over $8 million, or 6.3%. And move on down, if you would please, John. You see the total expense picture there. This increase here is reflective of the 23 additional FTEs that are being budgeted for next year, plus the inflationary aspects of labor management, labor unions and the like. So we're seeing an increase in personnel costs of these three amounts right here, which looks to me to be about $5.9 million. Dropping on down to the total operating expense line, we're seeing an increase in operating expenses of $9.2 million. With a good portion of that increase being money that we are spending on Meditech Expanse. In purchase services. Right here. Total operating income is expected to go from 2023 forecast of $1.3 million to almost a $2.5 million operating loss for next year. And expenses are driving that, with about $1 million of that being that Meditech Expanse project. So on the total surplus line, we're forecasting for 2023 a surplus of $1.170 million and a budget for next year of about $215,000, or a decrease in total surplus of about $956,000. And again, virtually all of that decrease is a function of Meditech Expanse and the costs associated with that, which we've got forecasted to end in the month of July. So we're going to be encumbered with those costs for the first 6 months of the year.
Just a quick question, obviously, Meditech Expanses was unforeseen specifically, and it's a big expense. Are there any options to reduce the scope associated with that, or reduce the expense, or are we pretty much locked in?
We're all in, and we need to be all in.
Yeah, you'd rather be.
We do.
So on the clinical side of it, there's going to be some very difficult to predict efficiencies that may come from Meditech Expanse. There's a lot of times being on two different electronic health records, one for the outpatient, one for the inpatient. There's a lot of time spent looking for reports, looking for results, ordering, and all that communication back, not just for the clinic staff, but also the hospital staff, sending reports back and forth. And for the clinicians, taking time away from a patient care to look for this stuff. And so it's really hard to define exactly what the savings would be and the efficiencies, but once we're all on the same electronic health record, there'd be times when the clinician will be able to bring things up right away, and it's not going to involve other clinic staff and hospital staff calling back and forth. You'll get the report right away and just move ahead and take care of things. So I think in the long term, we're gonna see some good benefits from that.
You're an independent clinic. Are you gonna be able to tie into us then?
We're working on that, and Tim and I have been talking on how we can make that work better.
So we could get him to pick up half the cost.
And I wish.
Not that big of a clinic.
But we'll be able to send things, send orders to you to get
Much more.
X-rays and referrals and lab tests and that much more efficiently.
I just wasn't sure how the independent lab or clinics would marry into. what
Yeah, so there's some ways that we'll be able to order things electronically that way. We won't be doing our clinic visits on the same EHR, but efficiency is going to be coming from us being able to order things without having to fax things back and forth. And it's going to save time on both sides.
And the reporting side of things, so that care's more efficient overall.
There's probably a significant, I don't want to say enormous, but I would assume there's a significant shift in patient attitude and positive customer experience that we're going to get. I've personally been told at least 5 times about somebody in the community that they couldn't get their records, that was wrong, it was, it's cumbersome, et cetera. And those lead to patients leaving. So let alone reputation. So somewhere down the run, we're gonna get some benefit out of that just on that alone.
Yeah.
So in the section below, total surplus, is, the statistics that are driving, those revenues and expenses above. And John, if you just kind of scroll through that slowly, and if you see anything that you have a question about, speak up, and I'll do my best to answer. So what you're gonna see next is, okay, so it's not the next thing you're gonna see. We'll see that in just a moment. This is our capital budget for 2024, and this is a compilation of all of the requests that I received from senior management and in our department directors as far as their needs for capital equipment and whatnot for next year. And with our aging plant, it's not surprising that most, if not all of those items are replacement items. And you see that in the second column.
Can I ask you a question about the pumps? Obviously, that's a gigantic sum of money. And the quote is end of life 2024. Are all 98 purchased all at the same time and they all run out so that they're not amortized over?
No, they would be purchased over the course of the year instead of in one bulk purchase.
How many pumps do we have? If you're buying 98 of them.
I don't know the answer to that.
I think it's pretty close to that number.
So that's why it leads to the question,
It's replacing everything.
Did we buy them all at one time and now they run out?
So typically what happens anymore, you're used to, you can split no buy now, but typically what happens now is you'll get a better deal on it because it's a special tubing and not gonna get your tubing for free or lower cost or whatever, so you usually
So
so
bulk pricing.
Yeah.
Yeah, obviously, chunk of change.
Well, and these will integrate with Meditech expanse, so everything that's on there will automatically go in, so save the nurses some time from documentation, things like that.
There's some safety issues regarding using the same pumps, the same tubing everywhere in the facility, because if you're changing one thing to another, you grab the wrong tubing, or someone's not familiar with that pump and they don't use it properly, it's set wrong, the wrong rate. So having everything the same in the facility is more efficient and safer for the patient, because it's what they use all the time consistently.
So not to belabor this, but is this what's the lifespan, 5 years or?
Typically,
And so next year, for example, would we put away in a holding fund 1/5 of this and the next year 1/5, so that it's not almost a $400,000 expense in 1 year? I mean, it's
possible. Yeah, if the money's there, you can do that.
okay. Thank you.
Continue on down there, you know. Okay, so, at the end of the day, $1,535,369 in anticipated capital acquisition. And so move us along to the next page. And this is a reconciliation of the 2023 forecast on the top line to the 2024 budget.
Should you go back? I'm sorry.
Yeah.
Sorry. You just went quickly at the last part. Flooring. There's probably more of a story here. It says all carpeted areas of the main hospital, and it says replacement. That's not really correct, accurate. Is it replacement? They're not replacing
We're not
carpet.
replacing carpet, replacing it with vinyl,
Yeah,
whatever's appropriate.
So much longer lasting
Yeah,
material.
much safer.
Yeah, I don't want anybody to get the wrong idea. That's,
And that's moving way up on the list of things to do.
well, and cleaner,
Much
it's easier
better.
to clean the carpet, and we discussed this in an earlier meeting. That it will be similar to what we applied in our other hallways will be replaced. So it looks really nice.
Yeah. So, we are budgeting at almost $1 million less in surplus for next year. The components of that decrease are found below here. So, for example, Meditech expanse is going to bring our bottom line down by $920,000. Increases related to labor unions, $1.1 million. The 23 FTE addition is going to add a little more than $2 million in costs to the picture. The price increase, this is very conservative. The volume increase, the 5% here, the 8.7% there, those things. Self-funded to fully insured is gonna add $540,000. To our bottom line, clearinghouse migration from as a clearinghouse to probably SSI, 250,000 addition, and so on and so forth. And you come down to the $955,000 difference. And I'm here to answer any other questions.
so the 1.147 million for labor unions, is that an accurate statement? Labor unions? What do you mean by that?
Well, we are, there are three labor unions that are involved in the personnel at this hospital. And they negotiate increases at periodic times.
Basically wage increases.
Okay,
So it's already in the contract.
right.
Yeah.
So is that really accurate to say labor? It sounds like we're paying money to unions
Well,
as opposed
Yeah.
to, it's a labor cost.
It's a labor.
Your
cost.
compensation.
Right.
Wages,
Yeah.
for that much by the month.
Yeah, I can see how you can read it that way, Greg.
Right. No more vacations for the CEO and specialists.
I'm tripling that.
Last year, yes, generally, we have a black book that where the board members will approve the expenditures for the month. Would it be possible for you to make that available 2 days before the budget, before the board meeting every month? For the board members to review before we try and review it?
I can make available whatever you ask.
And it can
Somebody
be
has to be
available
careful.
in your office. Okay,
Yes.
okay, good, thank you.
Well, and this particular meeting is the cart before the horse, because our meeting is tomorrow morning for the review,
Right.
but moving it forward for Thanksgiving kind of put us opposite.
Exactly.
But yeah, 2 days before, for especially when people coming in.
John, any public input?
We have nobody with their hand raised at the moment.
Okay.
You just hear us.
Listen, or
Okay.
Any more discussion?
Good job, Paul.
So I'll make a motion to approve the 2024 budget.
1 second.
Any more discussion? All those in favor?
Aye.
Opposed? Motion passes.
Thank you.
Thank you both. Okay, next on the agenda is resolution 459. Approving the board meeting dates for 2024.
Wasn't that just changing the day of this meeting?
Right. No, it sets the calendar for the year, I think.
Each year we need to set the board dates by resolution.
Right.
So we did change one date on that resolution, and that is next November. Instead of being the third Thursday, we'll move it to the second Thursday, so that we don't have to change it at a time or to meet the November 15th financial day. Budget day.
They just didn't print it out, but it came out on, in what John sent, and it shows each of the 12 meetings.
Shouldn't it
You
state
do have
that?
it, I think.
Shouldn't it state that in the resolution, because basically it's changing it to the second day of November 2023.
When you printed it, I don't think you printed what you sent by email,
Yeah, it isn't here.
because what you sent by email was accurate.
Yeah.
And there was a third page.
Okay.
This might be actually what Brad Burke modified it to.
Yeah. 459. Thank you. We should make a motion to approve the resolution as amended.
Second.
Yeah, so that basically, we won't sign anything until after the meeting, you'll have to bring it back.
Okay.
Okay, correct, second, yeah.
Right.
All those in favor?
Any further discussion? All those in favor signify by saying aye.
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 Opposed? Motion passes. Next item on the agenda is resolution 460, approving 2024 hospital levy.
All you can explain that.
So the EMS and regular hospital levies are reflecting, the 1% increase that's allowed by law year over year. Collectively, between those two levies, the increase in cash coming to the hospital will be about $160,000 in total.
I'll make a motion to approve resolution 460.
A second,
I second that.
any further discussion?
Just clarification. Is there a relationship between the 10,000 person increase in population and the 1% increase? Or is that just to add some rationale, or feature that would dictate while you're attempting to raise it by 1%?
I don't know the answer to that. I believe we have consistently increased that levy by 1% in past years.
Yeah, we have.
Yeah, what he's basically saying is because the inflation, the
Mhm.
property values, basically the tax base will increase. And we're taking a percentage of the tax base, so there would be an increase in the amount we would receive before the 1% increase.
Mhm.
And I forget where I read it, it may have been in resolution 462, even though it's not repeated here. So it says here at the bottom, if you don't mind, this would be, I think, clear. RCW blank blank provides that the limit factor for taxing districts with a population equal to or greater than 10,000 is the lesser of 101% or 100% plus the rate of inflation. So the rate of inflation is 5.74, I think it states here. Why would the increase not be based on that? I'm new to this particular thing, so
Right.
it's not a leading question.
I think to answer that question, I would need help from Christina Mayhew. Because she and I were directly involved in this.
Yeah. It just seems like we're
And I
slipping.
leaned on her.
This is a community health system. It was
Mhm.
enjoined by the community, it's for the community, it's a critical access hospital, it's a public health district. It's not our job to find money.
Mhm.
It's the community's job and the hospital, the healthcare system, and we share in that burden. So if inflation is X, there should be a burden on the community that requests that there be a hospital and a healthcare system. Makes sense to me anyway.
Right.
I don't know if it does to anybody else.
Here's one thing I remember Christina saying to me. She says that the percentage coming to us next year as a percentage of property values is less than what it was in 2023.
Okay,
Because of the increase in property values. So I think it has nothing to do with the increase in property values.
okay. That part makes sense.
Mhm.
What doesn't still make sense is what I read.
We're not asking for 5% instead of 1%.
Yeah. Just imagine next year, 1%, inflation's 4.8.
Mhm.
Now we're behind 9%. Next year, 1%, inflation's 4%. Now we're behind
I
13%.
think we're allowed 1%. Or else we have to go out for a special maybe.
I think that's.
Yeah.
And it's almost one that you'd have to go back to Brad Berlin. But yeah, we can, by resolution, we're allowed to go up 1%.
Right.
Because if we, without a vote of the public, but if we went up higher than that, then we have to go out to the public.
And that's helpful because that was one of my questions. It sounds like we're approving something
Mhm.
that's basically community funded.
Right.
But if the RCW allows for the 1%
Mhm.
based on the board resolution, then that could at least be done, and then there's an additional request that would have to be featured in the check. But you can see where this would go. I mean, ultimately, there's a price to pay for this healthcare system.
Right,
But that's where you go out and do a special levy.
Right.
So,
Right,
Okay,
that's that.
okay, there's a motion on the floor. Any further discussion? All those in favor signify by saying aye.
Aye.
Opposed? Motion passes.
Mr. Chairman, may I make a comment? Doesn't have anything to affect that, but it might be kind of nice to have our treasurer come and explain how the levies work and how the tax structure and the 1% and that. Do we enjoin our community members to come and speak and kind of educate us as well?
Well, I think that's probably a very good idea. What do you think, Paul? You want to give a couple of?
I'll reach out.
That's a really good idea.
well, basically, you know, each state can operate differently.
Yeah,
You're originally not
Right.
from Washington, so it's a little bit of a learning curve.
Mhm.
But I think if you read the RQWs, you can get the, you know, auditor up here or whatever.
Of course. Yeah.
that would just simplify things. It'd be really great to
Yeah.
kind of know.
It's
Just everybody's, you know, there's carrots.
Like I said, I leaned heavily on Christina Mayhew and she understands this stuff inside and out.
Yeah.
So I'll reach out to her.
Complicated.
Thank you, Paul. Okay. Next item, resolution 461 EMS levy.
It's, I think, the same thing.
It
will
is the
allow
same,
certain, you know, percent.
1%. Year over
He
year.
actually does have to go out in the community on that one. I would make a motion, this is just giving our EMS director the authority to go out and present this to the public and get them to vote on it, so. I'd make a motion to approve resolution 461.
Second,
Any further discussion?
just a question for Ron. Go a little bit further. The EMS director, he does what? He
Well,
goes-
basically, they have to go out, because they're actually going for a lift. And so they'll actually have to go out and campaign, you know, for it. And so, right, our resolution sets it so he can either go out in April, August, November, whatever fits into his time frame the best. And then they have to present it to the public, you know, here's what we're trying to do, this funds the EMS system. And, you know.
So it's an actual ballot?
Yeah, it actually goes on the ballot,
Okay.
you know.
Plan is going on in August.
Yeah, that's what I wanted to hear. Was it a formal ballot measure?
Yeah, it is a
That
formal
Once they
ballot, yeah.
determine the correct time or the appropriate time. Okay, that makes sense.
And it'll end up on the general since it's after the primary. Are you
Well,
saying
basically,
they'll vote on
it
it
can
in
go, it
August?
can either go April, August, or November.
But Tim was saying August, so,
He's leaning that way.
oh, okay,
This basically lets him, lets. the
have some
EMS get
flexibility.
the Flexibility
Okay.
to see how it conflicts with anything else, so.
It is a presidential election year, so there'll be more people voting, so it might be good to get it on the one where there's gonna be more activity. For positivity.
There again, I'll make a motion to approve resolution 461.
Second,
Further discussion? All those in favor? Opposed? Motion passes. Next item. Resolution 462, approving the 2024 budget and tax levy. Well, you want to explain that one?
it's the combination.
Yeah. Just an official.
Yeah, so consistent with the budget that I just presented, I'd like to ask for approval of this resolution, which signifies acceptance of the budget and the tax levy associated with it.
Discussion.
Already done.
I'll entertain the motion.
Your turn.
Motion to approve resolution 462.
I second that.
Further discussion? No further discussion, all those in favor, signify by saying aye.
Aye.
Opposed? Motion passes. John, do we have any public comments?
The moment. We do not.
Okay, Dr. Lenny, you are up next.
Afternoon. Continue to add to the providers here that are working here at the hospital. We have new appointments, initial appointments for David Morrison, MD, Sound Physicians Hospitalist, provisional active. Linda Tripolino, family nurse practitioner, behavioral health at the Friedland Golden Clinic, provisional active. Stephen Montgomery, CRNA in anesthesia, provisional active. And Henry Yee, MD, orthopedic surgery, beyond courtesy. And in addition, Dr. Yee has not been doing a lot of surgery in the last couple of years. And there's a special doctoring program that's been put together by the surgery committee to make sure that he is up to speed on all the procedures. Dr. Addition will be supervising him in this, and as he demonstrates proficiency in each of the listed procedures, then we're signing up. But we're asking the board to approve him as active as long as he completes these this proctoring program as designed by the surgery committee.
Do I hear a motion?
Motion to approve.
I second.
All those in favor?
Aye.
We have one advancement.
Motion passes.
Yeah, Michael Fortney, MD, diagnostic imaging courtesy staff.
I hear a motion.
Move to approve the advancement.
Second.
All those in favor?
Aye.
Motion passes.
And 6 reappointments, including Dale Addition, orthopedic surgery active. Michelle Ove, CRNA anesthesia active. Craig Clegg, CRNA anesthesia courtesy. Chase Simpson, CRNA anesthesia active. Carter Singh, MD, telestroke courtesy, and James Wang, MD, telestroke courtesy.
I make a motion to reappoint.
Second.
All those in favor?
Aye.
Opposed? Motion passes.
And that's the end of my report.
Thank you, Dr. Okay. Dominic.
Thank you very much. Nice to be here again. Just a few things to report. Joy was here 7th to the 9th of November. Obviously a very heavy focus right now on AR collections. Joy has put together a plan of action together with Paul. So we're hoping to see some good improvement there very soon. Julie, from a strat planning point of view, we'll be reconciling and putting all the notes together from our strategic planning session. I think probably in the next week or so, she'll be setting up a call to go over the changes in the strategic plans. And then once that next step is done, the next step, the final step would be to get the approval from the board for the full strategic plan. I don't have any information right now with regards to the action plan and the tactics. I'm waiting for Julie to advise me on what the next steps are there. The interim, from staffing point of view, the interim CDM coordinator, Amanda Leibovitz, is starting December 1. As I understand, that's all been cleared, it's all signed off and she's ready to go. The director of revenue cycle, permanent position, we've just restarted that search. So we should have some candidates very soon. And then just to let everybody know, that Patrick, you all met Patrick at the strat planning retreat. He's going to be a lot more involved now moving forward as opposed to John Freeman. We haven't done an official handover yet. John is still involved, but I just wanted to let you know that Patrick will be getting more and more involved all the time. John did review the 1231 audited adjusting entries, I believe, for you. The audited, adjusted entries, I believe, went to John to review
Yeah.
from 12/31/22.
Mhm.
Okay, so I wanted to just let everybody know that,
Yes.
that he has
And
done
then
that.
Patrick Banks as well.
Patrick's also gone through it,
Yeah.
okay. And then a quick update from Faith, care coordinating numbers through the end of September. With 54 patients were billed against a target of 50 patients. So that seems to be going well. And then the last little thing is, I know that Patrick supplied some intros for Moss Adams as well as the cost report preparer. And I have sent, the final thing is I have sent out an email to everybody with regards to the 2024 conference in Margaritaville. Within that email, you are actually able to book your hotel rooms. So I've also sent it to John. So John, if you wouldn't mind just distributing that to everybody who should be getting it. Thank you. And that's all from my side. Thank you.
Dominic, I might also mention that Patrick has indicated that he will be coming up here and is setting up some classes on proper entries and proper handling of the cost report, which I feel will be extremely beneficial.
I agree.
So,
I'll make sure that I stay on top of that.
good, thank you. Okay, now we have Samar, the foundation report.
Thank you. Hello, everyone, and thank you for inviting me today. So I'm gonna go through these slides very quickly, and you have to print out so you can see what you get to go online. So we've been, this year has been very successful. We've had 3 record-breaking fundraisers. As you can see, with the gala and the Georgia Whitby and the tournament, the 3 of them, we had the highest number of participation, the highest number of revenue, the highest net profit. We'd like to jump from this into the appendix very quickly. So with that, I'd like to highlight the following, because this has not only been participation, as I mentioned, it has not only been the number of revenue and net profit, but we've seen something really outstanding with the redesign that we've done for the Georgia Whitby website. As you can see here, we've got an increase of 1,750% in page views. And that shows how much the engagement reaching the community. And then an increase in unique visits of 1,284%. And this is something outstanding to mention. And with here you can see, the comparison between all last year versus this year, where you see these numbers, versus just from July to September, in 2 months, we're able to get 20,000 visitors to the website. And these are outstanding numbers that I wanted to highlight. Thanks. With that as well, looking at the highest day of the year that we've got activity on the website, we're seeing here, for example, on July 25, this is the day that I sent the mass email, the mass email campaign, and that specific day to see like the evidence how the metrics we can follow, how these email campaigns have an impact. You will see 1,100 website visits with 467 unique visits. And that number is compared to a whole year last year. Full year, one day was able to get these numbers versus the full year 180 visits. So in one day, we got 1,109 versus 1,018 for the full year. And these are numbers that are worth looking at with all the work that we've been doing on not just going out and talking to the community, but as well, this is evidence of how people are opening the email campaigns, are very much eager to see what we put on the website, and you can see as well the clicks and stuff. Can you move this, the next one? So with this as well, I'd like to highlight that, with the Facebook, for example, it is just a one post. And we boosted that one post on August 8th, which got results in after 12 days, only 12 days, 36,358 views. So people reached out, looked at this and all this link clicks, 934, these are people that clicked and went to the website to make a purchase and join. And the post engagement, this is extremely important. In these 10 days, we got from only that one post, 1,500 engagements. These are people that either liked or shared or commented or interacted with us. Next. Then with the email campaign, outstanding results. And I would like to highlight here, these are the results of per industry. You would see the open rate per industry for nonprofits 39.1%, for the health industries 34.9%, all other industries 34.5%. And now look here for transparency, how I'd like to share all this. All these email campaigns that we have sent, all of them are way much higher than even all the industries combined. So you would see here 82% open rate versus here, we're seeing 34%. It's a very successful rate for any other industry. And look how outstanding, 86%, 72%, even the lowest is at 47%, which is extremely higher than this. And then we can track the click rate, the bounce rate, even the unsubscribe. You would see the unsubscribe, and I put it as well for transparency. Here it's all 0%, and here is just 2% of people unsubscribe. So I wanted to highlight this information. Next, please. These you have them if you want to look at the last 3 slides on the analytics for each of these fundraisers that we've done. So you have it in front of you. If we go back very quickly to the presentation where the 4th slide here. And from here, next, please. So I'd like to mention to the community, because they're watching us, that yes, we've reached our $500,000 goal to fundraise for the 2 ambulances, and the ambulances are here, they are bought, and thanks for their generosity. Next. And this year, we have, in the last 10 months, allocated around $1 million, more than $1 million to support Whitby Health and to support, the patients in the form of patient vouchers, grants to Whitby Health departments, and scholarships to Whitby Health employees. What's next for us? And I'm going to cover only one. The other one will leave it for another meeting. So now I just want to focus on what's next right now, and it's in front of you, the campaign to empower our family birthplace. And you will see the target audience, and it's a target audience because we'd like to reach everyone in the community. Next, please. And with the campaign objectives, and this is what I would like to mention, it's not the campaign only to mobilize resources. Mobilize resources is number 3, but 1 and 2 are extremely important, that we want through this campaign to educate the community that yes, number 1 is yes, the birth center is open. A lot in the community think that we do not deliver babies here. They think that we are closed. So our job out there as the foundation is not just only mobilize resources. Our job and the vision that I'm moving forward with is to educate and to be the face of the community, as mentioned in the contract with the hospital in 2007. Next. You can see as well the KPIs based on what this campaign that we're working on, we're going to be evaluating ourselves. Donation raise, it's 1, but the other 3 are the website traffic and engagement, social media engagement, and the attendance at the community awareness events. And these are very much linked to the very much importance, because we want awareness and we want people to know more about it. So I've put 3 KPIs in addition to the donation. Next, we are having One of the community engagements and events that we're working on is the open house. Would like a commissioner from the team would be able to join. It's an opportunity to meet with community members and connect with them. Next. And then finally, would like to mention that this campaign fully sets to launch on the Giving Tuesday. And we are hoping to relaunch the philanthropist newsletter, and that was a newsletter that stopped in 2013, and would like to bring it back to the community, and that would be a great opportunity. And then we started right now working on design for the whitbyhealthfoundation.org. And you can access this website. Please do access. You'll see 3 pages that we shared now as a sneak peek. Hopefully on the Giving Tuesday on January 28th, you'll have full access from the website. And finally, the campaign features a diverse range of print, digital, and public awareness events. Thank you. The last part, I would like to speak about the last part at another time, maybe in December. Thank you.
Question.
You can't sit down.
We discussed an additional campaign with the supermarket. Can you highlight on that, please?
Yes, so this is one of the components of the campaign. So in addition to, as I mentioned, the print and the digital, there's other ways. One of them is the Checkout Charity. And the Checkout Charity from not just only supermarkets, we're reaching out to stores, supermarkets, and to like Home Depot and others. And we're probably not with this campaign, we're trying to sell it with this campaign, but probably because we need to be on their schedule and calendar during the year so they can put us for a specific time. And just to explain what that means, it's when you check out at a restaurant or store, you can contribute $1 or $2 or round. Yes, so this is a great idea that Mr. Boulder has proposed, and we're working on it.
Thank you.
So Mark, if you take a look at, your events, you have the gala, the tour to Whitby, and the golf tournament. Those are all like, the gala's on South Whitby. The golf tournament's down there. The tour to Whitby is kind of almost a central Whitby thing. If you take a look at the chart up there, the North Whitby area, the EMS is running about almost 16,000 calls. Central Whitby is 2,000, South Whitby is 2,300. And I know these events take very little time to put together for you. But have you thought about putting something together? One of the things that I think we're missing up there is the fact that with all the Navy stuff that we're taking over and the hospital closed down, maybe a golf tournament up there, either at the Whitby Country Club or at the Navy golf course. I think you could draw in a lot. You take
Absolutely.
a look, and we need to get our name out there better on North Whitby. That we are the hospital to go to, and in a lot of the conversations we've had, Island Hospital would rather have the Navy people coming here than bring them over there. And I think we're kind of missing that boat. We need to get out there, and I think we're missing quite a bit of money on the north end.
Absolutely, this is a great point, and this is where strategically I started working on it, where I joined as a member for the Navy League, so I'm a regular member with them, and I joined the MOA, but not only joined, I've been voted on last week as a board member, a director with MOA. So I've been working a lot in the north, but to add to this, it's early to announce, but I'm gonna just mention that you're gonna see next year an additional event. It's gonna be called the Veterans Day Banquet, and that's gonna be a Veterans Day event specifically to honor our veterans. We'll talk about it as well later, but absolutely, because we have around 42% of our population that are either military or affiliated with military. One more thing I'd like to mention, Mr. Ron, since you asked about this campaign, choosing this campaign strategically is as well to serve the north part and the veterans, because Oak Harbor is 2 times higher than the national average of birth rates. And with looking at the statistics and the data and seeing it's 12 times higher, and with the other factors of the hospital on the base not being open anymore, and the other factor that the island hospitals are at capacity, all these factors, when I talked to Curtis, we decided that yes, this is, the project to go forward with, and of course with Nathan. So this is another way as well to serve the military community, and I reached out to the base, in the last couple of days, invited the skipper of the base and the skipper of the clinic to come to the open house and to share with all their community as well, and family members to come. So you're gonna see more and more events tailored as well for the different stakeholder segmentation, different segments in the community. So there's gonna be in 2024 events and things tailored to the Gen Z, the younger ones, high school and Scout and NJROTC, and then other stuff for the different segments.
Thank you, Samar.
Great job.
Smart, first of all, this is really a great presentation. You missed your calling. The tour to which several people were concerned about the condition of the roads based on the amount of gravel and glass, et cetera. It's really common. If you would just make sure that you get with me at least 2 months beforehand. I've got 2 contacts that I've been able to make with WashDOT and the guys in Coopville. And with that kind of lead time, they will absolutely clean both sides of the highway from beginning to end. But they need a good 2-month lead time.
Absolutely, I very, very much appreciate.
And you could
this.
even advertise that a little bit, when you somehow weave that into the thing, because people spend a lot of money on these bikes and their tires, and they're very concerned about breaking down after a 100-mile run. I mean, it's a really big deal.
Absolutely. We'd like to meet together, then we can,
Right.
to talk more about it. It's a great point, thank you.
Okay.
Absolutely.
Ragnar would probably play into that too, because they're on foot, so if there's, I know on one corner out by the school, there was like all kinds of screws, somebody probably came around the corner and it just dumped out, but that's, the bus is coming in there, cars are stopping, kids are walking, so. Yeah, this is great, great
Thank
idea,
you.
great.
And then tomorrow, my office still stands about the Twitter would be. And
Yes.
I'd be very happy to sit down with you. I know that there are a number of areas that I can help you increase your revenue there.
Absolutely,
So-
absolutely. So, he's a cyclist and a professional, so listening to his feedback on ways to, thank you so much.
Absolutely.
Yes,
Just let me know.
I very, very much appreciate your offer, thank you.
Pleasure.
Samara, can you announce the date of your open house, date and time?
December 1st, sorry, at 10 a.m. in the morning,
And where is it located?
at the family birthplace. So, providing the opportunity for the community to come meet with the professionals and meet with our physicians, talk to them one-on-one, connect and engage, and then to tour the facility and learn more about any employment or volunteer opportunities. And we're gonna have mommy mimosas.
Mommy.
That's very nice.
Yes, that's our
Very
treat.
smart.
And can you explain where the family birthplace is?
So yes, it is at the, at the hospital, at Whitby Health Hospital in Cookville here. And with the RSVP that we put in social media and on the QR code on our website, for the people that will RSVP, we'll provide them more of the directions and how we're gonna meet them at the front entrance, and we'll have signs on how to get there.
And the big lobby area outside of that.
Exactly, they meet at the lobby, we'll meet at the lobby area and take them for a tour.
Okay.
And the physicians are gonna be available and team available to answer any questions and connect closer with the community.
Thank you, Samara. We really appreciate you.
Yes,
Thank you very much.
Nicely done, Simone.
thank you.
Very well done.
Good job.
All right, next is quality compliance report. Shannon.
Welcome everyone, so we're bringing it up momentarily. All right, so November quality report for the board. Next slide, please. So DNV, we're still preparing for ISO 9001 certification training with leadership. Hopefully that begins January of 2024 in preparation for our DNV survey in June of next year. Our education department is still working on the CNA program, working on the training requirements, the curriculum, and then submission to DOH for the program approval for the CNA. Workplace violence events, we had 3 for October, 2 were verbal and 1 was physical, no staff injuries. Year to date, we are still less than 2022. Culture safety survey that we submitted for all staff, we had 211 responses. 26.92% of them responded 4 out of 4 for their morale being improved over the last year. And then also 25.14% responded 4 out of 4 for feeling that they have a safer environment to practice and carry out their job duties here at Whidbey Health. For quality data updates for the Accountable Care Organization, we are joining that Medicare Shared Savings Plan starting January 2024, and that coincides with Meditech Expanse implementation July of 2024. So there's a lot of work being done in the background with quality and Accountable Care Organizations and the metrics that we're collecting to make sure that we're not duplicating the work, but we have that transparency going forward with the bills. For policies, action plans are in place to address the overdue policies by the end of December 2023. You're pulling the policies, we have less than 240 overdue at this point. So kudos to all the teams involved. That's a significant amount of turnaround this year. Yep. Medical staff credentials and MEC appointments awaiting board approval. Initial appointments were 3 and 7 reappointments. Credentialing applications in queue are on the right, and it talks about different locations. They are very busy in the medical staff office, to Dr. Lenny's point. All right, National Compliance and Ethics Week was this week, or last week. Whidbey Health adheres to the principles of just culture. Really, truly, self-reporting is highly encouraged across all staff. And we partnered with the Rural Collaborative for a compliance questionnaire and talking about awareness of compliance and ethics. It was a 15 questionnaire that was sent out. All right, patient experience trends for HCAHPS. That is that Hospital Consumer Assessment of Healthcare Providers and Systems. We are transitioning that platform to Qualtrics. So we have access to that data in real time instead of Survey Vitals. So a lot of work to come. We're hoping January, but maybe delayed till April. We still have access to those scores until then. Emergency department last 180 days. My provider listened to what I said and was courteous, was 4.68, which is above benchmark. So kudos to that team. Experience with social work was also high. If you could go back to that slide, that's okay. With 4.69, and EMS, our emergency medical services team, 4.66, based on the survey scores returned from our patient satisfaction. Wow. Very high scores. Would recommend or return in the last 90 days, very high scores noted. And then also both Whidbey Health Medical Center and primary care specialty clinics saw an increase of 0.01 from the previous board report last month. Any questions? Oh,
All done.
Yeah.
Thank you, Sean.
thank you.
I'm gonna adjust the agenda a little bit. We're gonna jump back up to resolutions. We have a correction in the new resolution number 463. This is the one that finally adjusts the dates for the board meetings for next year. So it's just basically the revision motion. So I would entertain a motion to accept this resolution 463.
So moved. Second.
Any objections? All those in favor?
Aye.
Motion passes. Okay, let's go back down to operations and outpatient services. Nathan.
Just a quick update on recruiting. We have a general surgeon that's in the military that we're trying to get to come here when she gets out this summer. We have a basic agreement in place, but she has signed an agreement to provide per diem general surgery coverage starting in February to kind of try her out, and she can try us out. Hopefully that leads to her coming here when she gets out in the summer. You heard earlier, Dr. Yee's coming to join us temporarily to help Dr. Addition. Still looking for other orthos. We do have Grace Wright started this month at our walk-in clinic in Oak Harbor. Jeff Carroll will be returning to the Clinton Walk-in Clinic in January. And we are on track to open our Cookville office on January 9th next year when Dr. Dimmer will come over and start there. We've also recruited a nurse practitioner to join him in February. Another primary care provider, Dr. Hurst, starts in April as a walk-in clinic provider. And then we did have our new palliative care provider, Christine Emily Delore, started this month. And Stevet Javier will start next month. So we'll be up to 3 palliative care providers. Linda Tuzolino started in behavioral health this month. And we have signed a contract with Lauren Cotton to be the 3rd provider, and she will be here in September of next year. And we are working on our contract negotiations with the telebehavioral health services to be provided in the clinics and not only in the ER. And as far as everything else, pharmacy, we've increased our staffing a little bit. We're looking to try to be open on Saturdays. Once the walk-in clinic here in Cookville opens, they'll be open about the same hours. And starting a pilot project for delivery to some of our employees that work on our outlying areas. We hope to expand that to include more people as we go. That's it for operations.
Are you getting much feedback, Nathan, on the orientation program, the revision to the orientation program?
Yeah, I mean, it's all been positive. It's been very well received since we expanded it and lengthened it.
Right.
So, and I think it's going well. Tim can probably speak more to that since he's involved with that committee, but I mean, everything I've heard has been very positive.
It's all positive. People are really liking it and feeling that they're getting a lot more information and feel better suited when they actually go out to their departments if they're well informed and really appreciating the extra time.
One of the questions that I had with regard to that, obviously, we've had a significant number of new hires over the last year or so. Do we have any, or have you considered any kind of a sponsor or a buddy program? You know, where somebody comes in and kind of takes a new person under their wing that could be in the same department or not, because you know, that first 2 weeks to 4 weeks is just so critical to feel welcomed. And the orientation program is obviously very significant. And that's great. You've done a really excellent job. But somebody that, you know, can kind of buddy up with the new person and answer any questions, maybe drive them around, you know, show them where restaurants are, you know, just the odds and ends, but just so that there's somebody there that's not an official person in HR, you know.
I mean, as far as within the building, they pretty much go to the supervisor for that. They're responsible for that. As far as external, I don't know if we really have anything formal in place. Yeah, but somebody certainly look at.
I just mean, you know, somebody that's either in their department where they kind of trade off, and you know, I'm Teresa and I'm in the following department, and Sally's going to come in. You know, that's my sponsor, my buddy, or whatever you want to call it. You know, and there's at least a face that sort of knows to bring them around, introduce them that perhaps the supervisor hasn't had a chance to do it. Anyway, just not a decision, just a thought. Sure.
Nathan, with the Providence on strike right now, short staffed, I mean, are we handling, I mean, contacting them as far as, you know, because all the cardiacs from, what is it, Cookville or Green Bay South, go to Providence, cardiac issues, go to Skagit on the north. You know, are we talking to them at all?
So it's not a direct conversation, but we do have everything posted and send out emails and flyers about our openings. That's about all we can do right now.
Yeah, I just didn't know if we had, you know, we hate to send the EMS down there and getting diverted to where.
Yeah, it's an interesting situation, but we are doing everything that we can right now to try to get them. We're sticking with it.
Okay, Paul. Thank you.
Yeah.
Okay, so this is a presentation of the October numbers for Ruby Health. Days in AR, 56.8, that represents a consistent gradual increase month over month from a low in August. And something that has my attention, and like Don mentioned in his comments, I'm working with Joy to reverse that trend. For the month, go down just a little bit, John, to the P&L if you would. So we are reporting a surplus of $80,389. Inpatient volumes were consistent really with past months, 83 admissions. We saw an increase in ER visits. We saw an increase in outpatient hospital visits, and clinic visits were all real strong. So very good month with patient volumes. We did report 25 million plus, almost 26 million in gross patient revenues. Expenses were higher, almost $1.7 million higher than budget. But those increases in expenses are consistent with the increases in the patient volumes. I want to draw your attention to this number, total net surplus year to date. Think back to last month. That number was about $1.3 million. So you would expect with an $80,000 October that our year to date number here for a total net surplus would be in the $1.4 million arena. And so let me explain that to you. We recorded entries to the January through September period in the month of October that changed that year-to-date number. And this is all part of compliance with those two GASB pronouncements. And what was done in October is part one of part two, and had we had more time, we would have gotten part two booked in October too. And I say all that to say that those earnings that are absent this month will be there next month, because part two will have been booked by that time. I hope you're understanding of that. It's an oddity, but one that was necessary. And like I said, those dollars will be there next month. Just a temporary thing. And in the interest of time, that's my abbreviated report for the month of October. Questions?
Nothing in hospital financing makes sense.
Can you just talk a little bit to the change in total margin? Obviously, a fairly significant decrease, 1.38 for September, October's 0.35.
Will you put that back up on the screen, John? We can see exactly what Mr. Richardson is stating. Yeah, go up, John. You're talking about the margin up the top. Right?
Total margin.
Yeah. Okay, so there you go, right here now. So we are showing over here a 0.4% positive margin on a year-to-date basis. This is on a year-to-date basis. Versus we were at minus 1.2% for the year at December 31, 2022.
Sure, right.
Yeah, so significant improvement in those bottom line numbers. It's certainly good to be positive. Is there anything other than that?
Thank you, Paul.
No, you've answered all the rest of them. Thank you.
Okay. Thank you very much.
Thank you. Mine will be brief. Not a lot of changes on everything from the last report. We are currently with the DI project. We have submitted all the training data on power loggers to LNI, so we'll wait for their response. So we can continue to move forward with getting the CT up and running and get that portion completed.
What was the term you just used? Power log? Did I?
Yeah, so we had to install 5 power monitors,
Oh,
and they
wow.
actually log, what the usage is, if there's fluctuations, they want to verify, you want to see what the loads are. Because we're actually reducing the loads when you buy new equipment, especially when you're replacing something 30 years old, it tends to be more efficient. But they want to make sure if our loads go up, that we're making other changes necessary. Our loads actually went down. So we're just waiting for them to respond so that we can continue with their permitting and get this turned around. And get our CT inside, running things other patients to the outdoors. We are expecting the new X-ray on the 28th of this month. So that first phase, which is the X-ray room and the CT room, we'll get those wrapped up so that we can start phase 2, which is getting the floor ready and getting an actual floor from the building again operational. So we haven't had one for 2 years. So, and then work continues in the lab and in the new building where we'll be moving the women's. And they'll be opening up over there on January 2nd. We did order 2 more ambulances. They will not be here until 2025. There's an 18-month wheel time on these, so we need to get on the list. Because we have a lot of units sitting in repair shops and it's costing as much as a new one over the course of the next year or 2. So we want to make sure we keep them in a regular schedule.
You can tell the foundation. Make sure they know that.
We will be reaching out. Hopefully getting some assistance.
That's 2 more ambulances, please.
We'll name them after
Yeah.
you.
Yeah, and you're in the Samara ambulance.
So then, yesterday, we did some more leadership training we had like 13 new leaders that were part of it. That went through the culture training that we have been doing for all leadership. And it went very well, very receptive. So we continue to work on the culture here in patient care, customer service. And to kind of follow up on your question before, so the first part of organizational culture was to focus on what we can do to improve the culture, right? So we focused on rounding and developing our leaders to follow some practices that have been proven over time to work and help improve culture. The second part of that was improving our orientation process, building that up rather than an 8-hour, you're in, you're out. You haven't really learned the culture and the expectation of the organization and met all the requirements for OSHA and CMS before you actually go out on the floor. So the next portion that we'll be working on is more leadership development. And part of that will be their orientation, because once a leader has their orientation, like general orientation with everybody else, they have a little bit more to learn, budgets and other things that go on within the organization. So we got to develop that part of that orientation for our leaders, and part of that will be looking at the buddy system, and a lot of organizations do that, where it helps really establish retention, and you have partner people up together to help welcome them into the organization. So that will be, but this is an ongoing thing that, because we're doing a lot of this internally, we're doing it in steps and it takes some time, but it's going well. That's my update. I know it's brief, but not a lot of changes. There's a lot of work going on.
Good, thank you. Okay, next we have Nathan, and he's going to do the nursing report, resource report, administrator's report, and can you also include a marketing and PR report?
Okay. Nursing report, not a lot has changed, still trying to replace some of our traveling nurses for full-time staff, it's going in the right direction, going slow. But the only other thing Curtis wanted me to mention was we did bring in, remember our ITP, the telehealth psychiatry portion for the ER. Our former company, average response time was between 8 and 12 hours. Our current company is averaging 2 hours and 9 minutes, and they apologize for taking so long. So their placement time from the time that the patient shows up until the time that they have a placement, not necessarily the patient's gone. If they have found a placement, it's just under 11 hours. So they're actually finding placements when necessary, even quicker than the other places even responding in some cases. So it's going extremely well. One of the things that was happening with our former company was almost everybody was an automatic inpatient, needs inpatient admission. And these guys are doing much better. So we've had 20 cases, 10 placements, and they were placed in 6 different facilities, depending on what they needed. So they're actually doing good assessments and interviews and putting people where they need to be, getting them where they need to be seen. So it's so far been a great result in all the things that we were looking at that we had problems with in the past. And so that ties into what I mentioned earlier, that we're going to look at starting to do this for our clinics, to try to use the same company to do outpatient support.
Can you just take a second and walk us through what happens during one of those processes? Is the patient, after waiting 2 hours on some form of a team or Zoom call with that telehealth call, and then they'll spend an hour, I mean,
at least an hour.
counseling, or
It depends on the patient, what they need, but they'll do a full assessment. Determine what the patient's underlying issues are, what the best treatment plan is, and then they'll start working on a placement if necessary, which has been extremely challenging trying to find placement, but so far they've done an actually outstanding job in finding people where they need to go and get them out.
And is there a rough percentage, you weren't prepared for this, I'm sure, but rough percentage of solutions that are based on the telehealth revisions versus being assigned an inpatient spot?
I'm trying to look here. We had 11 inpatient and 9 outpatient. So it's about a 50-50 split. Only 1 involuntary placement, or the rest of them were all voluntary. So I think that speaks to the type of interaction they're having with them. But yeah, I would say we haven't had any outliers that I see on this report. Again, this is our first report for October, so it's only 1 month, but Curtis, the interaction with them is so much better than our former, and that it's really helping the ER and getting people turned over.
This probably sounds like a stupid question, but do the members, the greater group of members of the ED, are they provided training on how to recognize emotional behavioral challenges? Is that?
Yes.
I mean, I would think so, but
and there's a lot of resources through this company that we can utilize for even further training.
Right.
And so we probably haven't got very far down the road since it's only been a month.
I would just think that'd be very hard, because obviously you could be really agitated, but you're not having a mental health crisis, by the same token, you could be real quiet and be melting down, so and those guys are healthcare professionals as opposed to behavioral health,
Yeah, exactly. Yeah, they bring a lot of resources, and I think we'll see even more once we get it in the clinics, when there's another program we're looking at with them down the road, for a different type of service that would provide even more behavioral health.
And the last question, that's billable event, I take it.
Yes, okay, yeah. Okay, as far as human resources, about the only update, Paul looked at our open position. It felt like there were quite a few, but when we compared overtime and travelers, as far as the number of FTEs we're paying in overtime and our travelers, it's pretty much equal to the position we have posted. So I think we're in a good place as far as number of people we've added. We still need to make some changes and some adjustments down the road, but as much as, you know, I look at the numbers and see our numbers going up as far as salary costs, it's necessary. And I think eventually it'll get more in line and be consistent. So that's the only thing from HR. We are finding a few hiccups in our open enrollment going from the self-insured to fully insured. It's just a couple of things. There'll be a couple of changes just temporary for next year, and then we'll be able to address them. There's some things we just did not have the time to do that may be an additional cost to employees, but we're looking at ways we can make that better.
Did you mean that the opposite, going from full insured to self-insured?
No, we're going from self-insured to insured outside with the carrier. We've been self-insured here for health insurance for employees.
There's something else that was self, yeah.
Yeah, so. As far as my report, not a lot to add. I did go out and meet with many of the providers out of our Cabot Clinic last week to discuss some of their concerns, and it really boils down to staffing. We need to get, you know, more nurses out there just like we do here. So that's one of the biggest challenges, and more providers. We're looking at that. I think Meditech Expanse will alleviate a big portion of the things that are taking extra time for them. Of course, that's not until July, so we're looking at what we can do in the meantime to make it better. Marketing and PR, I've got marketing focused right now on redesigning our web page, things like that, internal, that may not be very obvious to you guys or to the external people yet, but as we start ramping up our marketing, communicating our services, things, I want to make sure that everything is internally ready. So if I talk about women's health and the birthing center, somebody goes to our website and there's no information there, then we've blown our opportunity. So before we start really pushing a whole lot of marketing plans and stuff, we need to make sure that everything internally is ready for that. Right. So that's what they're focused on right now. She's redesigned our web page. She's redesigned our internal employee website, web page and portal. Still responding to all the requests we're getting. We've had a ton of public requests for information here lately. So Connor's been working on that, but I don't like to start putting too much out there until we're ready for it. So that's what I've got her focused on right now. So, and then Samara and I went last week to did a presentation, and Dr. Casapos joined us, and that was very well received. Where at MOA,
Military officers.
Yeah. So that's where we are. We have 3 more planned or scheduled.
Yeah, the upcoming one is is in December for the Lions Club.
So going out and talking, Dr. Casapos actually joined us and did a great job. A lot of interaction with him, and it's very helpful. Nice to have a provider there. So do you have any schedule for the old goats? Yes, but I can't remember.
Or
what it
the
is.
Old goats on
No.
Saturday.
I have something on my calendar for that. I can't remember when, but I'll let you know. We do have something on there.
You can't call us that.
I didn't make up the.
Is that?
Want to go?
Okay, any comments? All right, under general board items, the new committee assignments are out. If anybody needs a copy, I have a copy, or you can get a copy from John. And now we'll move into commission comments. Greg, you want to start out?
I honestly don't have any comments, just a delay. You know, there was a draft agenda that we brought up a couple months ago. I think probably let's just wait until January, February timeframe when we kick off the new year, and we'll bring that up again and get inputs.
I've been enjoying having the second seat over here.
He's happy.
Morgan.
Yes, I would like to formally congratulate Marianne Julas and her win to occupy the seat for position 1 here at Woodby Health. This is my last board meeting. I get a little emotional because I'm invested, but I want to express my gratitude to all of you. I am so impressed. I've been around hospitals for the last 20 years. And, you know, the process is always very similar. But always there is this evidence of growth and learning and applying. So application, you know, new processes, new equipment, new technologies. It's constantly a moving, you know, and growing and evolving business. But healthcare is different than any other thing that we do in the market, and that is that we touch people every day. And it is important for them to feel cared for. We strip their name, or well, not their name, we take everything that's personal away when they come into the hospital, and that's all they do get is their name, date of birth, and you know, and their MRN number. And I think it's important to remember that our caring is a way to just sort of give them back. That's where we get the gratitude from the community and the feeling that our hospital truly does care about what's going on here. I'm so thrilled with everything, but I know that Marion will do a fantastic job. I emailed her yesterday, and so we communicated together. But I do express my gratitude for this opportunity to serve my community, and I thank you.
Thank you.
Next board meeting is going to be December 21st at 12 o'clock. In light of the fact that Morgan and Eric are stepping down from the board, we have a little celebration for your services and what you have done and how much we appreciate you right out in the hallway here. So.
Oh, is that what the clatter was about? The reindeer have arrived and it's early. It's not Thanksgiving yet.
That's it. That's for you. So.
Thank you.
And if you have no objection, we'll stand adjourned.
All right, thanks.
Thank you. Very gracious of you.
Oh,
Very
no
impressed.
worries.